Now, a new medicine center that's set to launch in NUS is aiming to cut carbon emissions from hospitals and clinics. And the Center for Sustainable Medicine will be part of the NUS Yong School of Medicine, and it will be launched on 1st of December in Dubai, the UN Climate Conference COP28.
For more on what the centre aims to do, we have with us Professor Nick Watts. He's Director of the Centre for Sustainable Medicine. Good evening to you, Professor Watts. It's good to see you.
Very good to see you both.
So tell us about this Centre for Sustainable Medicine. What's it all about?
It's a good opening question. Listen, climate change for too long has been about polar bears and it has been about trees, and it has not been enough about the health of our patients. It has not been enough about what it means to try and treat a child with silent asthma and the terror that goes through a family, the terror that goes through a nurse and a doctor when they see that. The Centre for Sustainable Medicine that we're launching, it exists to do two things. It exists to tackle the health impacts of climate change. They are many, they are varied. The World Health Organization has called climate change the biggest global health threat of the 21st century. It did that in 2023 after COVID. The second half of that, though, is that we know as good doctors, prevention is better than cure. And so we know that you need to tackle climate change at source. You need to directly reduce the emissions of healthcare all the way down, like you said, to net zero.
Right.
Well, it sounds like you have a lot on your plate, Professor. But trying to get the health sector down to net zero, that is a very difficult thing to do, isn't it?
I agree. It's going to be tough. We need to be honest about these challenges. There are going to be barriers in the way, but there are also going to be things that enable us, that push us forward. We've seen from healthcare systems around the world when they have tried to tackle this, number one, for every dollar that you invest into low carbon healthcare, you wait 10 years, you get that money back threefold. This has an investment return like almost nothing else in healthcare. Number two, we have seen every time you try and intervene to improve the healthcare system's efficiency, to tackle the emissions of healthcare, you actually do good for your patients as well. You end up delivering better, higher quality care. And number three, this is in some new research that we commissioned as part of the centre's launch. We know that our staff love it. We went out and we asked Singaporean healthcare professionals right across the country, hey, what do you want to see the healthcare system do more of? The response was thunderous. 88% of Singaporean healthcare professionals want to work for a healthcare system that is living up to their own values. First, do no harm.
When it comes to, going net zero, as far as the healthcare sector is concerned, though, Professor Watts, what do you target first? Right? Is there sort of a rank of what you really have to hit from the beginning?
The problem with climate change is that there's carbon everywhere, and so you have to hit absolutely everything. But you can categorize it in a bunch of different ways. There are drugs out there with very, very simple alternatives. There's one out there, every single use of that drug, it's called desflurane, is the equivalent of burning 440 kilograms of coal. Just a deeply carbon polluting drug that, quite frankly, a modern healthcare system does not need. There are better drugs available for our patients. There are other drugs out there that have emissions potentials, warming potentials 1,200 times higher than CO2. So some of it is about tackling some of those drugs and moving across to better medicines for our patients. Some of it as well, if you're a patient, you might recognize on your ambulance in your way into hospital, it's a quieter ambulance, it's a nicer ambulance to be in because it's a zero emission ambulance and there's no air pollution that comes from that. It's fully electric. You might see that your healthcare system is providing you with more choice now, that digital medicine, remote care, care closer to home is something that you see in a low carbon healthcare system because the emissions there are simply lower. You will see changes right the way across a healthcare system. What I think has become clear just in the last couple of years is where healthcare has been slow to the fight, slow to take on climate change. Just now, we are really accelerating. And just like you saw throughout 2020, 2021, 2022, when the healthcare profession moves and starts to engage, it can move mountains.
And you've mentioned that there is this enthusiasm of, people in the healthcare sector, wanting to go out there, look for alternatives with medicines and things like that. But your new medicine center, part of its role, as you mentioned, is also to tackle an increasing, number of patients who have climate-related symptoms. Or can you just tell us how worrisome that is, or that will be?
Sure. The problem with climate change is not when it brings one disease. It's not just the congestive heart failure that comes from heat wave. It's not just the epidemics of dengue fever that you are starting to see out across the region. It's when you get an epidemic on top of an epidemic, followed by a flood, followed by a storm, followed by repeated heat waves. It's that multi-hit scenario that starts to wear away at the adaptive capacity of healthcare systems. There's a study in France looking at exactly this multi-hit scenario from climate change. 73,000 deaths occur in just a 5-day period because of multiple risks that hit the French healthcare system all at the same time. The problem, yes, was climate change, and yes, it brought those threats, but really what happened was the healthcare system wasn't able to respond. Really what happened was that the healthcare system was overwhelmed. And so the Centre for Sustainable Medicine exists to make sure that we are ready for those threats so that we can continue to provide high-quality care for our patients.
Well, what I hear you say, Professor Watts, is that ideally all hospitals or healthcare settings should be net zero and they should be sustainable. And I mean, is there going to be an additional cost to that? I mean, you were saying earlier that there are sort of alternative things which are not necessarily going to put price pressure, but is that going to be something that it's going to be a challenge to see that all the way through?
So this is one of the interesting things about low carbon healthcare, and in part it is because of the carbon intensity of healthcare systems. What we've seen so far is that the return on investment for every intervention you could possibly want to put forward is 3.6 years. This saves money like nothing else. And you can take that money, you can reinvest it back into care for your patients. Patients, I think, should only notice an improvement in the care that they're being delivered. They should be happy with the choices being provided to them. To the start of your question, though, 5 seconds ago, there was only one healthcare system in the world that was tackling this problem. Then there were 2, then there were 3. This centre is going to be the biggest of its kind anywhere in the world taking this on. There is now global momentum. We have at the UN negotiations in Dubai in just 3 weeks, the very, very first time there's a health ministerial summit asking what can healthcare systems do to accelerate this. I think the signals we see now convince me that this is not just something fun, it's not just something positive on the side of what it means to be a doctor or a nurse. This now is the inevitable future of healthcare.
So just going back to patients again, I just want to clarify. So that means that they won't need to pay more for the health services they'll be getting in exchange of trying to go net zero?
Absolutely not. And at any point that a doctor, any point that a healthcare system sees anything that could possibly compromise patient care, patient access to care, we should stop that, right? We are interested in improving the health of patients around the whole. And so everything we've seen so far suggests that this should save money for the Singaporean healthcare system.
Sounds good.
All right, Professor Watts, thank you so much for coming in and sharing those details with us and what the future is going to look like at the Centre for Sustainable Medicine at NUS.